My name is Amol Nirgadkar. I'm the CEO of Patient Prism, and I'm having all sorts of amazing conversations with Ryan Vett, who's an expert dental consultant who consults practices across the country on branding and marketing strategy. He is extremely connected to dentistry. He's married to one wife, Jessica, and he's really inspired many team members across the country to really create experiences that are worth sharing. In this segment, though, we're going to kind of break off a little bit and ask you about setting the right expectations, because every dental office at some point in their life cycle decides to hire one or more consultants, right? And it's so important to set those expectations correctly so that you are geared towards success.
Exactly.
So tell us your experiences and when you've talked about hiring the right dental consultant in your practice. What are expectations? How do you set expectations, and how do you make sure that that relationship is going to be successful?
Right. More often than not, a dental consultant leaves a hero or a villain. The hero is, you just changed my office, my team's jazzed up, I'm so excited.
Right.
Or the villain is, you just cost me so much money and
Correct.
nothing's going to change.
Right.
And so the question is, how do you hire that right dental consultant and set those expectations? And one of the biggest things is, why are you hiring the consultant in the first place? Ask
Sure.
yourself that and understand why, what your problem is, and then also figure out, what do you want the result to be? So a lot of people think that the dental consultant's going to come in and point his or her finger and say, do these things, and then it's done, and it's magic,
Right.
and it works. That never happens. It just doesn't happen, unfortunately. There's probably 1 in 100 practices where every team member is totally bought into whatever the dental consultant says in that
Right.
1 day window and
Right.
does it, and the other 99 practices are left shaking their heads saying, I spent thousands and thousands and thousands of dollars and nothing's different. So part of it, one of the biggest things is, what do you need done, and what's your problem? And then how are you going to then implement and follow up on whatever the dental consultant says? Because if you're not willing to continually invest after that consultant leaves, it's not going to work.
Right. So it's not like a magic bullet, right? A consultant comes in, all of a sudden solves all your problems, and then goes away. Because if there's no accountability, right?
Right.
You've got to set up accountability and get those expectations, because again, the problem is a lot bigger than what it appears to be.
Exactly.
What we've seen, and so getting those expectations and getting your team members ready,
Right.
is what you're saying is very important.
Prepping your team members in advance is critical. Like 30 days out, hey, we're having this consultant come in. Here are the problems that I hope to solve. It's not that you're not doing a good job, because that's another big thing. Team members feel inferior when a consultant comes in. They're
Right.
saying, I'm not doing something right, or is
Correct.
my job in jeopardy?
Correct.
And so it's saying, no, we can do better. We can figure out how we can take our practice to the next level. You're the right team members, and I'm bringing this person in to educate all of us and help us all grow professionally and personally. And setting those expectations in advance, and then leading up to it, have the consultant set expectations at the beginning of his or her time there, and then after, it's often the office's responsibility to follow up on those items. Usually consultants come in and they leave, or they have a 1-month agreement.
Sure, to kind of follow up and stuff.
Exactly.
But is it also important to kind of set the expectations with the consultants themselves?
100%.
Is that this is what we plan to accomplish, and this is where we want to get to from point A to point B?
Right.
And then how do you plan to execute this,
Right.
so that there is buy-in from my team?
Yep.
And what do I need to do? So maybe the consultants can help us too, right?
Absolutely.
In getting the buy-in.
And I think a lot of offices don't typically know what they want their end result to be.
Sure.
And even if you don't know what you want that to be, it is important to ask the consultant before the consultant shows up, because the
Sure.
consultant might be going this direction, and
Correct.
you might think you have an idea that's this direction, and before you know it, you're totally you're sitting there with your arms crossed during the consultant there, and you're just upset, saying, I'm paying this much money, and I'm
Right.
not seeing patients right now.
And setting them up for success, even the consultant, is important, because
100%.
otherwise, you're right, they come in and then
Yeah.
everybody has no idea
Right.
that they're coming in, and they're like just listening because they're getting paid, and they have no interest, because they're like, I'm not going to do any of this stuff. I'm going to go back to whatever I'm doing afterwards.
Exactly. And if if your consultant's not talking to you leading up to him or her coming into your office saying, hey, here's what we're going to be doing, there's a problem there. So
Sure.
you need to address that with your consultant too. You need to have clear expectations when that person's coming, exactly what to expect during that day or 2-day workshop, and what to expect on the backside of that.
That's a great conversation. I think everybody who's listening to us will appreciate this, because all of you guys do hire consultants on a routine basis, and getting those expectations correctly with your team members and with the consultant and with yourself as the dentist is going to be crucial for success. So thank you so much for this
thank you.
conversation. Thank you.